Thank you all for joining us today. I'm Assemblymember Rebecca Bauer-Kahan, and I'm so honored to be here today with several very important people at this moment in time for those of us that are heading back to school with our children. So we have with us Contra Costa County Superintendent Lynn Mackey. We also have Alameda County Superintendent L.K. Monroe and Contra Costa County Health Officer Dr. Chris Farnitano. And they're all joining us to have this really important conversation about what it means to send our kids back to school at this moment in time. And I know that we received a lot of questions from you all in advance, but I want to also say that if questions come up during this webinar or you didn't have a chance to send it in, feel free to use the Q&A function to put your question in, and we will get to as many of those questions as possible, although I confess we'll never get to all of them. But we are here to answer questions even after the webinar, so hopefully we'll address a lot of what you're thinking about. And I first want to start by thanking everyone who's with us for all of your hard work through this process to get our kids, for those of us with kids back on campus already, to get them back on campus and also prepare the students who are heading back in the weeks to come. And thank you everyone for joining us today. I know this is a topic that I can relate to some of the anxiety that we're feeling about sending our kids back to school. Two of my children are back on campus as we speak. And I know dropping them off on their first day, the excitement that they felt. My daughter came home on the first day and said it was the best day of school ever, which is always what we want to hear. So I know that they're so happy to be there. And, you know, we're all happy to be seeing those normal things. They feel a little less normal with masks on and the like, but we know that them being in the classroom and on the playground is where they should be. And so it's so good to see them back. But with that being said, I know that, you know, 2 months ago, we felt a lot better about sending our kids to school than we do with the Delta variant and where we are today with the coronavirus. So, you know, we want to talk a little bit about what the state has done leading up to the return to school, and then we will have an opportunity to talk locally with our education leaders as well as our public health officer about, you know, what we're doing to keep our students safe and ensure that we can continue to have our kids in school as every day for the rest of the school year. That's the goal. So, you know, one of the things that just hit the news this week is that California is the first state in the nation to require vaccinations for all of our school staff, or they have to submit to weekly testing. And I think this is a really critical step. It's actually what we've been doing in the Capitol for months. And, you know, it's a way to make sure that everybody who comes into contact with our children, be it their classroom teacher, the bus driver, the people who clean our facilities, are, you know, healthy and able to be there safely and keep all of our students safe. So I want to applaud the governor for this move, and to all of our school staff and teachers for being willing to participate in these important steps to keep our communities safe. I want to talk a little bit about the budget. We passed a budget that was historic in a lot of ways and really important, especially as it relates to our students. We knew that we needed to fund our schools and to ensure that they had the resources to do what will be required to educate our kids, but also to keep them safe. So we passed the highest level of school funding in history with $9.3 billion in ongoing funding, with a total of $9.3 billion increase, with a total of $93.7 billion going to our schools this fiscal year. So that's really exciting, and hopefully it sets our schools up for success. Although as a school parent in the district, I know we can always do more in this regard. And so we continue to work for stronger school funding. But some exciting things that come out of this incredible increased budget and budget surplus we've had this year. One is dealing with the food insecurity that so many of our students have faced, that has been exacerbated by the economic impacts of COVID-19, especially on our low-wage workers. And so ensuring that every single student has access to lunch and to meals has been a critical step that we've taken this year to prepare our students, because they can't grow up as healthy young children and succeed in the classroom unless they're fed. So that's a step we took to deal with childhood hunger, which we know is real. We also did something very exciting. So 2 of my 3 kids are fall babies and had the opportunity to do transitional kindergarten, but my third didn't because we had this weird system where only fall kids got to go to TK. That's changing. We're going to do transitional kindergarten for all 4-year-olds in California. And that's huge. We know that success of our students relies on how prepared they are when they start kindergarten. And so we really want them to have that extra year to prepare so that they enter and we know that they will succeed in school moving forward. Behavioral health, one of the reasons that I fought hard to get our students back into school, and I know all of you were alongside focused on this, was the mental health impacts that we saw last year of both the pandemic, but also of having our students isolated at home and not with their peers and their community. And so we took steps to ensure that there was behavioral health in our schools, that we're pursuing making sure they're learning, but they're also healthy, both physically and emotionally. One of the questions that we get a lot, and a really important one, is will the school shut down again? And we will talk about that more with our panelists, but I want to say that we did everything we could in the budget to ensure we were giving families who didn't feel safe returning the opportunity to do independent study, to remain in a remote setting, to do so with proper oversight, ensuring that that independent study was meaningful and students were getting the education they deserve, while also ensuring that parents had an opportunity to stay on campus if that was what was right for their family. So we worked really hard to ensure that that's what will happen this year, and I'm optimistic that we will be able to keep those students who want to be on campus and whose families feel good about it on campus throughout the year. We also worked hard for our older students to make sure that we were dealing with our UC, our CSU, and our community college funding. We know that one of the things that happened last year was a lot of students taking a gap year, and that's impacting our older students that are seeking higher education. And we want every student to have the opportunity to go to college and succeed, and we continue to increase those slots and fund those schools to provide those valuable opportunities. So that's just a little bit of what we did at the state level to really set our students up for success. But I know you're all here to talk about what's happening in our classrooms today and in the weeks to come as our students all return. So I want to turn it over to Dr. Farnitano to talk a little bit about what we're doing to keep our communities safe. I want to thank you for all of your incredibly hard work. I was saying to him when we popped on before that it had been a little while since we'd connected because things were going so well. And here we are again. But throughout this, he has worked so hard to keep our community safe, to get us to a place where our students can be healthy and safe on campus. So Dr. Farnitano, I just want to open by asking you to talk about this uptick in cases we're seeing as a result of Delta and what tips you have for families to stay safe.
Thank you, Assemblymember. Yeah, we are definitely seeing in Contra Costa County a rapid rise in cases and hospitalizations. That really started after the June 15th lifting of the state blueprint restrictions and lifting of indoor masking requirements, but really then accelerated after the July holiday and with the spread of the Delta strain of the coronavirus, which really since early July has been the predominant strain. The majority of cases we've seen, and now is really over 90%. So we're really dealing with all Delta all the time right now. And we're seeing similar trends across the Bay and across the state. And we're seeing, as expected, the highest rate of cases and hospitalizations in our communities with lower vaccination rates. Although we have over 75% of our county population that's age 12 and older, fully vaccinated. Some towns and cities in our county are below 65% fully vaccinated. So vaccination remains the key strategy to keep ourselves and our family members and our friends and loved ones safe. Even with the Delta virus, these vaccines are highly effective. They prevent people from getting infected. They reduce the risk significantly of passing on the virus to others if you do happen to be unfortunate enough to get infected despite vaccination. And they dramatically reduce the risk of being hospitalized, becoming severely ill. Most people who do get COVID despite being vaccinated have mild symptoms. Most of the people we're seeing filling up our hospitals right now are the unvaccinated. So getting vaccinated is key. The second best strategy, which adds on to that, is universal masking. Masking can, reduce the spread of the virus, especially in indoor settings. So masking indoors is critically important. We know in schools that most of the cases that we've seen and expect to see in schools are kids that got infected in the community, at home, or in activities they were doing outside the school, and they come to school with COVID. So everything families can do to keep themselves safe, be careful, get vaccinated, prevent our kids from getting COVID and then bringing it into the school environment.
Thank you. I have a 11-year-old who's turning 12 in the next couple months. And I asked him if I could take him on his birthday to get vaccinated. He asked me if I'd give him till the next day, and we agreed to that. But I know as a parent of 3 kids that are under 12, I'm eagerly awaiting approval of the vaccination for our younger kids, because again, it's proved so effective for the 12 and up set. So hopefully we can get it to our younger kids. Any update on when that might be coming?
We are still looking at September, hopefully maybe October, for when the FDA and the CDC will approve the vaccines for the 5 to 11-year-old group, those elementary school kids and middle schoolers, and then a few months later, probably for the toddlers and infants. But we're hoping it will be September. I know we're eagerly awaiting that, and our vaccine branch, our vaccine teams are really ready to go. We've been working closely with the schools to plan vaccine events at school sites, so that we can really get those vaccines into kids' arms as soon as the FDA and the CDC, decide and let us know the research shows that they're both safe and effective for kids.
Awesome. Well, as soon as that happens, I will be at one of your vaccination sites. So thanks for planning ahead to make sure we can roll those out effectively, because I know that having the vaccine myself has made me feel increasingly protected, which is really important and helped me protect the community. So you mentioned masking, right? Universal masking is really critical. And I know that our schools are requiring our kids to be masked indoors. And so I wanted to ask for advice about that. I know people are asking, we got some questions about, are there certain masks you would recommend that are better? Should we be looking for N95s for our children? Or what would you recommend in that regard?
What I generally recommend for kids and adults is use the best mask that you can comfortably wear. N95s are really difficult to wear all day long. I know because before I was vaccinated, I see patients in my clinic, and I was wearing an N95 all day long. And now that I'm vaccinated, I'm only wearing the N95 with my patients who are unvaccinated, and using a more of a paper cloth or paper medical mask most of the time. But those N95s they work really well, but they're really uncomfortable. The KN95s, is another type of mask that's really common. There are unfortunately, a lot of counterfeit KN95s on the market. So while a high quality KN95 is better than a typical surgical or medical paper mask, overall, because of those that are, the average KN95 similar to a medical or surgical mask. Then cloth masks are the next best thing, and the thickness and the tightness of the weave of the mask really makes a difference. Consider double masking. One way to tell, are you wearing a good cloth mask, is what they call the candle test. You put your mask on and see if you can still blow out a candle. If you can blow out a candle with your mask is too thin. It's not an effective mask. But it's really about fit and comfort, because you have to wear those for our kids. They're in class for many hours each day. So we want a mask that they can wear that's comfortable, that is not going to distract from their learning process in the schools, but the best mask that they can comfortably wear.
And if kids are okay with it, you do recommend double masking? I heard you mention that.
I do, if kids are comfortable wearing that, yes.
Okay. So currently, I can speak at least for the school district that I'm in. the kids are masked indoors at all times, but they do not have to be masked when they're at recess or outdoors playing. Can you speak to that? Do you think that our kids are still safe given the fact that they're outdoors together unmasked and unvaccinated for the younger set?
Yeah, schools are not required to have kids masked outdoors. Some different schools have different policies. And I think it's really, each school has to make their own determination depending on, the size of the school, the size of the student body, how much crowding occurs in outdoor settings. It's definitely a good practice when you're in an outdoor crowded setting to wear masks. So definitely would kind of encourage that on a voluntary basis for students to consider masking when they're outdoors, and for schools to consider, based on their particular setup, and if they're really going to have a lot of crowding in a lot of their outdoor settings.
Okay, thank you. So, as you mentioned, and I think that number is up even from the last time I heard it, 90% of the infections that we're seeing locally are from the Delta variant. Are we finding that it's more infectious or more dangerous for our kids? What are you seeing?
The data is still out about the effect of the Delta virus on kids. We know that it is more contagious for both kids and adults, and that it spreads. It's probably twice as contagious. Some estimates compare it to being almost as contagious as the chickenpox, which we know is one of the most highly contagious viruses out there. But there's less certainty about, is Delta making kids sicker compared to previous strains, and that data is not clear yet. We are getting reports from other parts of the country, like Texas and Florida, where they're having very, very high rates of COVID in both kids and adults, that some of their children's hospitals are really starting to fill up with sick kids. We're not seeing that in the Bay Area, and that may simply reflect lower overall rates and the fact that we've got much higher rates of vaccination in our adult and older teen populations. So that's helping protect our kids and keeping our infection rates in kids lower. But it's not really clear. It's definitely more contagious, not really clear yet whether it makes kids sicker.
Okay, well, thank you. I'm hopeful that we'll find that it's not, because the last thing we want is sicker kids.
Yeah.
So one of the things, I think, was it just today that the FDA approved booster shots for those who are medically vulnerable, if you will. Is that coming locally? Are we going to start seeing booster shots for those who are medically vulnerable, or for those who had the J&J originally? What are you seeing with that?
Yes, the FDA made an approval yesterday, and the CDC actually was meeting just in the past hour to make their own recommendations about booster shots. And what they are recommending is for specific individuals who have very severely impaired immune systems, people like folks who have a solid organ like a kidney transplant, or people who are undergoing cancer chemotherapy or other similar levels of suppressed immune systems. They are now recommending a third dose of one of the mRNA vaccines, a Pfizer or a Moderna, for those individuals. So our local vaccine sites next week are going to begin allowing those individuals who meet those criteria to get a third dose to help get a better response to the vaccines for those individuals.
Interesting. Thanks for being so on top of that. It's all happening so quickly. So one of the things you mentioned, which I know that my team had actually heard in a Safe Schools for All presentation, was that most of the COVID infections in schools, at least in the spring when we have data from, were coming from the outside, right? So people were getting these infections at home or at events and then bringing it into school, although we did see little to no community spread within the schools at the time. Obviously that could change with the Delta variant being more contagious. So what are we doing to can you talk a little bit more about the protocols in schools to make sure that those COVID infections that make it into our schools aren't spreading within our school communities?
Yeah, there's really been quite a lot we've learned over the last year about how to have kids in the classroom and do it safely. And there's been a lot of studies, both in other countries where they were continuing to have kids in the classroom, and other parts of the U.S. where kids were remained in the classroom or were brought back into the classroom during the past school year. And we learned a lot about what worked, and we learned a lot about what didn't work. What we learned is that masking, universal masking, good practical ventilation steps to have good ventilation in the classroom, symptom screening, contact tracing, and isolating close contacts of those who are exposed. When we do all of those things properly, the classroom is a very safe space and a very safe place for our kids. The studies that showed when those steps were all taken and done consistently, there were very, very few cases of COVID that were picked up at school, especially in the classroom. That spread in the classroom was extremely rare. We also had good studies showing that where it didn't work, where classes, schools were continued without universal masking, and that there were large outbreaks on the school campus. So we know the masking is one of the key strategies to keep classrooms safe. Most of these studies were done before teachers and older students were vaccinated. So now it's even safer because they have that room of protection of the vaccine for a lot of the students and the folks around them. So those studies are even more helpful and give us even more confidence that we can safely keep kids in the classroom if we follow these steps.
Thank you. That's super helpful, and it gives me some peace of mind just sending my own children into the classroom. So another question we got from the community is about monitoring illness in the classroom. So testing and the like, what are we doing to make sure that we know what's happening and that we're notifying families if there is an exposure or, God willing, an outbreak?
Yes, so there are key kind of public health steps that schools take that are really, really an important component of this whole approach. So, screening kids for symptoms, and educating parents to not send their kids to school when they have a fever, when they have, a cough, when they have a sore throat. Those are really important, and screening those kids when they come on campus. Some schools are doing temperature checks as well. That's it's unclear whether that adds anything. The symptoms screening is the most important because a lot of kids with COVID don't necessarily have a fever, but they have other symptoms. And then, kids with symptoms getting tested right away, not coming onto campus till we see that negative test result. And then if there are exposures, so if someone determined that they had COVID and they were in their infectious period when they were on campus, the local health department works closely with schools and the school staff to help figure out who was exposed, who was within 6 feet of that child for 15 minutes or within 6 feet of that staff member or teacher, depending on who it was who tested positive. And those exposed, students or staff, they need to then quarantine. Now, based on the studies that have been done and based on our understanding of the lower risk of classroom and campus exposures leading to infection in kids, the state has developed a couple of modifications to our standard quarantine that can really help keep kids in the classroom or get them back in the classroom sooner. One is a modified quarantine, where if there are kids who were exposed, but were wearing their mask, and the person they were exposed to was wearing their mask, what we call a mask on mask exposure, and they test negative and continue to test twice a week, they can stay in the classroom as long as they quarantine for everything else. Other out of the classroom activities, they quarantine at home, they don't go out to restaurants, but they can continue to stay in school, where otherwise they would have to go through a standard 10-day quarantine. The other thing is a shortened quarantine, and this is for all kids, whether or not they were wearing masks, if they have been exposed, but they get a negative test on day 6 or later of their quarantine, and they remain without symptoms, they can come back to campus on day 7 and be done with their quarantine. So there are a couple of strategies to modify those quarantine rules so that we can really recognizing the lower risk of transmission in kids, so that we can keep kids in the classroom as much as possible.
Thank you. I know we're going to I have a question for the superintendents about how we're going to keep our kids learning and engaged during what could be some quarantine. So, because that's really important too, but I appreciate you talking about that, because the quarantine, when I got our quarantine policy, was different than I expected it to be. And I appreciate you explaining some of that. You know, I do want to add on to a lot of what Dr. Farnitano has said, which is, you know, after vaccinations were widespread and many of us were vaccinated, we were able to let our guard down a little bit, right? Because we knew we were protected. And the breakthrough cases we're seeing, although again rare and we're protected in a lot of ways, do mean we need to put our guard back up just a little, especially for those of us that have unvaccinated children in the schools, to keep the whole community safe. And so I think this is a time where we really step up as a community and know that our first priority is our children, keeping them in the setting where they need to be in school. And that may mean doing a little bit less than we were doing previously in the spring and summer before we saw what we've seen with the Delta variant. So I hope we can, and I know, because I've seen how amazing this community is over the past year and a half, that we will come together and do everything we can to keep our community safe. So thank you, Dr. Farnitano, but don't go far, because I know we're going to have more questions for you from the audience after we get a chance to speak to our superintendents. So now to Superintendent Mackey and Superintendent Moreau, you know, first, thank you. I know that, you know, getting our kids back on campus in the spring and now again has been a Herculean effort, and it's taken a lot of changes. And you know, adapting is what our kids do best, and we're having to learn from them and do the same. So thank you for all your incredible hard work in doing that. So we'll start with Superintendent Moreau. Can you talk a little about what parents should expect as they head back on campus?
Absolutely. So Monday, you mentioned Assemblymember Bauer-Kahan that there was an announcement made. So Monday, the other hat I wear is the president of the 58 county superintendents. So I had the ability to attend that announcement, which was great. But what was even greater, please don't tell the governor, but what was even greater was to be there for the first day of school in an elementary school in Oakland. So really getting to see the excitement of those kids. For this particular school, only 2 families had chosen not to return in person, which was great to see. But all kids, you know, not a word or a worry about a mask. All of them had their masks on. Every now and then you'd see a teacher reminding, oh, pull, you know, make sure that gets pulled up to your nose. But it's just become the way of, you know, a way of doing business in our classrooms. As Dr. Farnitano spoke to, you know, the Delta variant has introduced some new variables for us in terms of, you know, as we learn about, you know, how this spreads and how it might be different, and certainly an elevated anxiety level on the part of parents in many ways. We are encouraging schools and seeing schools be hyper-vigilant in this way. Really, this is the first time for most of our districts, and I'll speak for Alameda County because there are districts in this state who never closed. They just kept on doing school, the smaller counties in large part. But for those who are coming back this fall, for some, it's the time that they've had full classrooms. And so really figuring out what that means. And some of that is, considering how you mask outside, get lots of questions. I don't know, Superintendent Mackey, if you would say this too, about lunch, how are they supposed to eat lunch? How far should they be? Should they all be outside? Should some be outside? So really figuring those things out. And I just really want to give credit to our leaders and our teachers who are having to figure this out in real time, every moment, every day. But the focus is always on how can we keep kids safest in this. So hopefully some of that answered that question.
Yeah, thank you. And I got to be at school because I was dropping my own kids off, and I can't, say enough about the joy on everybody's faces and our teachers. I kept thanking every teacher I saw for being there, and they said I wouldn't be anywhere else. They were all so happy to be back on campus as well. So you're right, but this is hard. I mean, this isn't easy stuff. And, to Dr. Farnitano's point, we have a lot of research, but it's also, this is a ever-changing situation. And so, our principals, our staff, our teachers are really doing an incredible job of, working to keep our kids safe. And I know I'm personally grateful, but also in my official role, I'm grateful. Superintendent Mackey, can you tell us a little bit about what to expect? And if you could throw in, we're getting a lot of questions about testing. So if you want to speak a little bit about what it'll look like at some of our schools as it relates to testing and surveillance and what we're going to know about what's happening on campus.
Sure. Thank you, Assemblymember, and thank you, Dr. Farnitano and Superintendent Monroe, for being here. I appreciate all of your leadership during the last year and a half. It has really been a heroic effort on everybody's part, and I do want to give the real praise to the district superintendents and their staffs and the teachers, and for doing some really good work last year for, those mitigation strategies that Dr. Farnitano talked about. We really put in plans in place last year around ventilation and hand hygiene and all of those things that are part of the Swiss cheese approach to mitigation factors. So a lot of this work was really studied and really put into place so that we could open up fully this year. So the work is all on their shoulders, and I really give the highest praise to our district superintendents for doing this work. So our county, we have 18 school districts. I think LK has the same. We have 18 very diverse situations in all of our school districts. So even locally, even the ones under your own jurisdiction, Member Kahan, very different contexts. So what I would encourage our participants in this this town hall is to go to the websites of whatever your local school district is, because the plan might look very different of what it looks next door or across the county, because of, as Dr. Farnitano mentioned, there's different vaccination rates, there's different spread rates, there's different context. So a testing protocol might not be necessary in one small school where everybody's vaccinated and they have a very high vaccination rate. They might just have a plan to send their anybody who's interested to their local testing agency. And then we also have school districts who are stationing testing sites on multiple days during the week so that people can get tested right on site. I've had emails from families who say they want a testing center on their school site, but their school site context might be it's just too disruptive in the school day. I mean, schools are very complex situations, and we need to try to run them in the most orderly manner possible. And so in some situations, it just won't be feasible to have those type of school sites. Many of the La Miranda areas have kind of done a consortium. We have many small school districts. So they've worked with agencies to have community testing sites that everybody can access free of cost. So each individual school, and even as far as masking on the playground, every local school board was able to make a determination whether they want to do that. And we do have districts in our county that will be masking on the play yard unless they're eating. So everything is very individual. Every school district has a plan in place, and they are doing the work to make sure that plan gets implemented.
Thank you. I can say I started my day actually at our school testing site, and there weren't, I'm doing my part, making sure my family's getting tested. It was during school hours, so I went. But, there weren't so many people there. So if your community is testing, I urge you to take part. It is help. All of that surveillance is really important to know what's going on, especially for vaccinated individuals like me who may not be showing symptoms, right? But ensuring that we're helping to know what's happening. So thank you for that. So speaking of vaccination rates and how that relates to our protocols on campus, can parents find out what the vaccination rate is of their school, especially for maybe our middle schools where students can be vaccinated?
Well, they will be able to. So the new order took place August 12th. I think that was just yesterday. It took official place, and we have until August 18th to fully have it implemented, where all of school staff will have to turn in proof of vaccination. So at that point, we know there will be a system in place, there will be dashboards, it will be fully implemented. At this point, there are schools that are able to show their vaccination rate, and there are some that are still gathering that data and getting that survey data. They will not be able to necessarily find out specifically whether their teacher is testing or vaccinated, right? So there is that either or, they're vaccinated or they will be testing. Got it.
And maybe when we see, hopefully those vaccination rates are very high, and we'll see that, and that'll give us even more comfort. So one of the questions that I think came out of some of the comments of Dr. Farnitano related to quarantine of exposed students is, what are we doing for those students to ensure that they don't miss out on whatever learning is happening while we know they're staying home to keep their class and themselves and their families safe? Any thoughts on what's happening in our schools as it relates to that? Should we start with you, Superintendent Monroe?
Of course, I think we can both speak to this. Our contexts are similar in this way. Something that I know that you're familiar with, Assemblymember Bauer-Kahan, is the new regulations around independent study. And so for families who, for whatever reason, feel either safer or whatever conditions exist where they want to keep a student home, that is available. We continue to believe as educators that in-person instruction is best for students. We are hoping, just as an aside, to put into practice some of the things we've learned during the pandemic that have actually enhanced educational opportunities for students that we wouldn't have otherwise maybe been able to. But overall, we want to make sure our kids are back in school. So for these short quarantine periods, independent study isn't necessary. However, when you're looking at 2 weeks over 14 days, that's when you're going to want to make some sort of official arrangement to ensure that students aren't falling behind, that they have an assigned teacher for an independent study context. Other than that, we, as educators, teachers are familiar with what to do when students are ill and how to make sure that work is getting home and how to continue to monitor their progress. And I feel that, whether it's the shortened or the extended quarantine, that falls within that period where that can be monitored effectively in the classroom. Beyond that, then we're looking for, something that wouldn't be normal, but another alternative.
Anything to add, Superintendent Mackey?
I just want to make sure that family members know that the independent study might look different in your different districts. So many of our districts are just contracting with, because they're so small, a small district doesn't necessarily have the capability of just implementing a whole independent study program, because it is a big lift to do that. So we have agreements countywide there. So if a family requests independent study, they might be receiving that virtual learning through one of the virtual academies in one of the other districts. So each district, again, has a different plan in place for how that will work. And they should really look and see how it will be working in their own district.
And that's helpful. I know that San Ramon Valley and Pleasanton in my district have had ongoing academies before the pandemic, independent study programs that are, I know the communities love and are very successful. And so those will be ongoing. But to your point, in some of our districts, it's new. And I think utilizing these successful programs may be a really great option. And also, I mean, I have to say, my daughter had some symptoms in the spring, and we kept her home just while we got her tested. And a lot of what we had learned during Zoom learning, I felt like went into play in keeping her engaged in learning during that time. Her teachers were putting the assignments up on Google Docs, which she had then become familiar with. And I think, to your point, we can continue to use some of those tools we got during remote learning to keep students engaged during these quarantines, so that hopefully they get what they need during these short periods, and we can keep them safe and keep the class safe while also ensuring they get some learning done. So hopefully people will do their part in keeping students home. Anything to add? So we touched a little bit on the independent study element. I know that is new to a lot of families who've decided that they don't, for whatever reason, they're choosing not to send their kid back in person. Do you want to talk a little bit more about that program and what we've done, what you all have done to ensure that it's going to be successful for students who opt into that? Superintendent Monroe, you want to?
Sure. As Superintendent Mackey said, our smaller districts are contracting with our larger districts. And as was mentioned, Pleasanton is one of those districts that has a robust program, and have offered to contract with some smaller districts who don't have one. And, I can't say enough, because we continue to prioritize in-person learning. It doesn't make sense for our smaller districts to try to stand up a program which is really designed for this unique period in time. Something that I think we didn't anticipate or are currently assessing is, as leaders, I would say probably all of us on this call and many people who are listening, we're planners. We like to see what's coming ahead, and we like to put things in place, and and we're used to doing that for new school years. None of us planned for the pandemic 1.5 years ago. And none of us have planned exactly for the Delta variant right now. So what we're seeing is some fluctuations in numbers of what families are choosing to do with, whether in person or remote, and a lot of what goes into making that decision is that school districts are not always able to guarantee that if you leave, your child will be able to come back right to the same classroom, because numbers, we have to move around numbers, make sure there are enough teachers for the number of kids. And so it's not ideal. It's not seamless. So that really has to factor in to, weighing the risk and really what's most beneficial for your child. And, I think remembering that, really that the virus is what we're all fighting, but also remembering that there are some indications for students that have nothing to do with the virus, that are mental health related, having to do with isolation, having to do with how your child learns best. So also really bringing all that into your decision-making process to say, okay, maybe there's a little greater risk here, but my child really hasn't done well at home, or my child really needs to be in front of a teacher. So having to assess, I don't envy parents now, yourself or others at this, there are a hard set of factors to weigh, and schools are there to help you do that. But at the end of the day, as families, you have to make that decision.
Thank you. Anything to add, Superintendent Mackey? No?
I think Superintendent Monroe really hit it on the head there.
Okay, then I'll ask you the next question, which Superintendent Monroe touched on, which is the mental health of our children. I know that we are all very, very focused on both their physical well-being as well as their emotional well-being, and that has to go into the decisions we make and the programs that we create. And so can you talk a little bit about what resources are available with Return to School to help children with their mental well-being?
Sure, and some of it will just be the practices that are going into place right now as of day one, making connections with the students, making that feeling of belonging, having a teacher who is warmly accepting them, and then teaching them kind of how to be in groups again. So we're seeing like different levels of stress and anxiety and mental health issues. And some of it's like kind of a low level anxiety just about what to be expected. They haven't been around a group in a long time. And we know that our teachers are really who are adept at like building community, right? Like what we want to see is students coming onto the community, feeling that sense of belonging and connection, and then really practicing those procedures of how to be at school, how to make friends, how to interact with each other. And then when we get, that's kind of to me like a tier 1. And then when we get to tier 2, where people might have a little more needs and a little more anxiety, there are resources both in our county. Our county has some really robust school-based resources that educators can reach out to. And then the school sites, many of our school districts have hired wellness liaisons, wellness coordinators to really help determine what is the needs of those students and how to plug them into what the resource is. We did in our county just received a fairly large grant through county behavioral health, and we'll be working with all the school districts to hire regional liaisons that will help to work with the health plans, because the health plans are also receiving funds and going to be much more involved in being a resource and services to families, because it can't just be about schools when it comes to mental health, because it is a health issue. So it's really about how do we work with our health plans, how do we work with our school-based resources, and then how do we just really build the resiliency and grit and belonging and welcoming for those students coming back onto campus.
Thank you, and thank you for such a valuable focus on that. Superintendent Monore, anything else to add?
Just quickly, I mean, that is it. That's, Superintendent Mackey really outlined the entire spectrum of what students would need. We call them multi-tiered systems of support and putting those in place. I think one of the things, you can put this under, hashtag COVID silver linings, when we talk about things like, oh, what are the instructional practices that can move forward with us that we have learned? Same thing with the mental health practices. Certainly, as a former administrator in Oakland, I begged for more resources for mental health. And now people are really starting to understand that, no, this shouldn't be extra and add-on. If you can, it needs to be part of a school culture, climate and culture, each and every day. So I am really gratified to see that happening, that people have that awareness. And at ACOE, we were standing up a social emotional learning division anyway, ended up doing it during the pandemic, which taught us a lot. So, squarely focused on that. So thank you.
That's so great. And it's interesting you say that, because as someone who works in the mental health space, policy space in Sacramento, the amount of support that we are getting now, especially as it relates to children, is incredible. Bipartisan across the state. You can talk to people from rural districts, urban districts, and everybody sees the value and need here. And that is really important. And I think it has increased, which is helpful to moving the ball forward. Okay, we are getting a lot of questions. So let's turn to those from the people who are participating. Dr. Farnitano, we got a lot of questions. You were saying, you're talking about testing for kids to know whether they should return to campus if they've been exposed, or just testing to make sure we know what's happening. And people are asking about what type of test is most acceptable and is most effective and is acceptable to end a quarantine.
So there's two major types of tests. There's the Pcr test, which is considered a gold standard test, has to usually be run in a clinical lab, and usually takes a day or two, sometimes 3 days to get the result. And then there are these antigen tests, some of which can be rapid tests with a result in 15 or 20 minutes. Some you can even, buy over the counter at your local Walgreens or Rite Aid store. The PCR tests, again, they're the gold standard. They're the most sensitive. They're really good at picking up people throughout their contagious or infectious period. And both tests are really accurate as far as if it's a positive test, it's almost certainly a true infection. The antigen tests, they're not as sensitive. So in people without symptoms, they can sometimes miss cases. They're really good though in symptomatic people. So, kids or adults who have symptoms, those are really good tests. Also, we now see there's lots of requirements for healthcare workers. Employers are making requirements for people who aren't vaccinated to get tested every week. And if you're testing that often, the antigen tests actually are pretty good, even picking up people without symptoms, because you're just testing that often. So those are, there's a couple different options, really. Again, the PCR is the gold standard, but for people with symptoms, either test's really good. I think the quality of both kinds of tests have really improved. There were a lot of kind of tests kind of thrown out there in the early parts of the epidemic, but the ones that have stayed with their kind of FDA blessing that are out there now are all very good tests.
Good to know. We got various questions about the science behind the spread of the Delta variant in schools among children, both vaccinated and unvaccinated. I don't know if the science is there yet or if it will be coming and how we'll find out, but is there any studies on what's happening with Delta in the schools?
Not specifically in the schools. It is new in the U.S. Again, it became the sort of predominant strain really mostly just in the past month. It certainly started in other parts of the country. Other parts of the world, and there's some experience there, but not as much studies looking at schools in the U.S. and the effect of the Delta variant. We do know it's more contagious. We do know the vaccines still work, maybe a slight decrease in how effective they are, but the vaccines are still highly effective against the Delta variant. The jury is still out about whether the variant causes more severe disease in either adults or kids. There are a couple of studies suggesting people, mostly adults who had Delta variant were more likely to be hospitalized, but jury's still out on that point. But as far as, I personally still have great confidence that these measures in the classroom that have been effective, shown to be effective with previous strains of the virus, will be very effective with the Delta strain as long as they are used very consistently. Again, the masking, the ventilation, the symptom screening.
Got it. Mark asked if the following school activities are permitted, and I don't know if the superintendents or Dr. Farnitano want to answer this, but under the current state and local health guidance, assuming indoor masking protocols are followed. So can parent-teacher conferences happen if everybody's masked? Can parents volunteer in the classroom if they're masked? And I don't know if schools have vaccination policies around that too, for parents who are eligible. And school field trips. So what's happening with those sort of extras and whether they're allowed under current guidance?
I guess I can say, and then maybe that one of the superintendents can chime in. I believe all of those things are allowed under the current guidance. I think each individual school may have different policies about which things they're going to allow or they're going to require, vaccination for volunteers. So, putting some extra layers, it's all about putting in different layers of protection. So the more layers you can put in, and the vaccination requirements is one layer, masking is another layer. But it's each of the individual school can set their own policies about these activities. Anything else to add from the superintendents?
I would agree. It's allowed, and each school, I do know the schools I've talked to, anybody coming onto campus, if they're going to be a volunteer, are going to be required to get vaccinated at this point. But some are not even wanting to really use volunteers just because they might have a bigger crowd. It's a more crowded school. So it really is a school by school, district by district call, but they are allowed.
I think the only thing I would add to that is that this question of field trips came up for us, and just pointing out the layers of consideration for schools and districts. If you're taking kids on public transportation, there are particular regulations right now that we've all gone back to masking. You're pretty safe, just to know everyone wears a mask all the time, but public transportation masks are required all the time. So just figuring out what each of those, wherever you're going, what the conditions are there that you need to adhere to. But it just really points up what our leaders and teachers are contending with.
Yeah, thank you. I know that my kids missed the field trips last year, so hopefully that's something we can get to at some point this year. Another question we got was, how will school districts be notifying parents and students if an outbreak occurs on campus?
I know that, so every school has a COVID team. A small district might just have a district level COVID team. And there are letters that go out, phone calls are being made. You might get notified depending on who finds out first. So there is a health department kind of arm of this, and then there's a school arm of this. So they might be finding out from the health department if that's who finds out first, or the school district. But there are notices that will go out, and some are notices that there was a case, but you were not involved, and you were, you were not a close contact, or it might be that you were a close contact and that you need to quarantine and then test after a certain period of time.
Okay, oh yeah, perfect. We got the thumbs up from Superintendent Monore on that one too. And hopefully none of us will get that notification, but we know that it's important that it's there if we need it. So one last thing that we've addressed, but I think is important because it came up a couple times. People were asking about, they said they're worried about their child who is unvaccinated and what extra steps we're taking to make sure the teachers or other vaccinated individuals that might be asymptomatic are not carrying it to these unvaccinated children. And as Superintendent Monore mentioned in the announcement that was made earlier, I think that the step we're taking to ensure that all teachers are either vaccinated or testing is a critical step in this, into making sure those are teachers and all staff, that those that are around our children are as protected as possible. But as you heard, different districts are taking different measures as it relates to testing. Beyond that is required now by the state of those staff and teachers twice weekly if they're unvaccinated. But we all want to protect those unvaccinated children, and a really important step to that will be getting those students vaccinated as quickly as possible once they're eligible. And as you heard from Dr. Farnitano, and I know the same is true of Alameda County, the counties are working diligently to ensure that as soon as those vaccinations are safe and available for our young children, that we give access to all of our families to those vaccinations so that we can get our children vaccinated as quickly as possible. And you will be our partners in that as their parents. So we hope that we can all get our kids protected as soon as possible, because again, the more people in our community who are vaccinated, the more our communities are protected. And we're seeing that now, right? As Dr. Farnitano said, with less children hospitalized locally, he believes it's because of our increasing vaccination rates. So continue to do your part to get our community vaccination rates even higher, although I will commend our community for how high our vaccination rates are today. We are outpacing the state, but there's always more we can do. So if you know someone who's unvaccinated, please have that conversation with them about the importance to your unvaccinated children to have them vaccinated when they're eligible. So we are almost out of time, and I want to be respectful of everyone's time, but I really want to thank the three of you. I know you're incredibly busy with the start of school and with the global pandemic. So, Dr. Farnitano, I want to thank you and all of your fellow health officers for your incredible work through this pandemic. I know I've said this before, but I'll say it again. The coordination between the Bay Area health officers to keep our community safe writ large has been incredible. As you see here today, I represent 2 separate counties, right? And so working across counties, working as a region has really been important. And you all have stepped up to do that, to keep our entire community safe, including our children. And I want to thank you for that. Superintendent Monore and Superintendent Mackey, I want to thank you both. I know this is a very busy time. I know you've been working incredibly hard to get our kids back on campus safely, to support our local superintendents and our staff and our teachers to make sure they have what they need to keep our kids safe, to get them educated, to make sure that we are giving them what they need to keep them both emotionally and physically healthy and prepare them with the education that they deserve. And we are partners in that at the state. And I know I fight every day to give our kids what they need. So thank you for your partnership and your diligent and hard work. So we are here, all of us are here to support you in making safe choices for your family, in getting vaccinated if that's what you need. Those continue to be available through both the counties and your local health providers. So if you haven't been vaccinated, I will again ask you to go do so if you can. And please continue to be diligent in masking and keeping our community healthy during this difficult time with the Delta variant. I know all of us saw the light at the end of the tunnel, and we didn't want to enter what is now a little bit of a darker phase in this pandemic, but we will get through this together. And but it will take each and every one of us doing our part, and I know you're all committed to doing that. So thank you. If you need help with anything, my staff and I are here to support you. My telephone number is 925-244-1600, and hopefully we will see you and talk to you soon.